Good morning. An intern is visiting a health camp and came across a child whose head was quite abnormal, as shown in the picture. On measuring her head circumference, the intern found her head circumference was grossly increased. What could be the reason for this? Yes, you're absolutely right. The main reason for this is hydrocephalus, where there is increased amount of cerebrospinal fluid inside the brain. Okay, now where is this cerebrospinal fluid located? The cerebrospinal fluid inside the ventricles of the brain. So today we would be seeing about the ventricles of the brain, and my name is Dr. Anand Srinivasan. So this would be the learning outcomes for today's session, that is the gross anatomical features of the ventricles, and also we'll be touching about the formation of the CSF and the applied aspect. The ventricles of the brain, these are small cavities as I just said before. So there are four ventricles in our body, two lateral ventricles, a third ventricle, and a fourth ventricle. So here in this picture, you are able to see the lateral ventricle, which is present in one of the cerebral hemisphere, and this is the third ventricle, and this is the fourth ventricle. The lateral ventricles are present in each one of the cerebral hemispheres. Okay, and it's also called as the cavity of the telencephalon. So if you could remember the embryology, so the telencephalon is the one which gives rise to the cerebrum. So the cavity which is present inside the cerebral hemispheres is called as lateral ventricles. The cavity which is present between the two thalamus, so that's called the third ventricle. It's also called the cavity of the diencephalon. And lastly, the cavity which is present just behind the pons and the medulla is called as the fourth ventricle. Okay, so it's also called as the cavity of the rhombencephalon. Now, if you could go through this picture, you can see all these ventricles are interconnected. The lateral ventricle is connected to the third ventricle, and the third ventricle is connected to the fourth ventricle. The two lateral ventricles which is present on each cerebral hemispheres, they get connected by this foramen which is called as interventricular foramen, or it's also called as the interventricular foramen of Monro. Through the interventricular foramen, they get connected towards the third ventricle, and the cerebrospinal fluid flows from the third ventricle to the fourth ventricle through the cerebral aqueduct, or it's also called as the aqueduct of Sylvius. Sylvius, Sylvius, right? So that's Sylvius, and this is called as the foramen of Monro. And after the fourth ventricle, so this is the picture which shows the central canal of the spinal, the lateral ventricles. All right, the cerebrospinal fluid, which is produced in the lateral ventricles, it goes through the interventricular foramen or the foramina of Monro, and from the interventricular foramen to the third ventricle, and the third ventricle through the cerebral aqueduct to the fourth ventricle. Okay, so now these are the ventricles. Now, if you could remember the layers of the cerebrum, so there is dura mater, arachnoid matter, and the pia mater. So just below the dura mater, there is arachnoid matter and the pia mater. Below the arachnoid matter is the subarachnoid space. The subarachnoid space contains cerebrospinal fluid. Now this is outside the brain. The CSF is produced inside the brain, but how does it come outside? Yes, it comes outside through two foramina which are located from the fourth ventricle. So this is called as foramina of Luschka and the foramen of Magenti. And through this, the cerebrospinal fluid which is present inside the brain comes outside the brain into the subarachnoid space. And from the subarachnoid space, it has been absorbed through the superior sagittal sinus, through the arachnoid granulations. The lateral ventricle, as we know, it is situated in each one of the cerebral hemispheres. The lateral ventricle has got the following parts. The one which is present in the center, this is called the central part or the body of the lateral ventricle. There is a small projection from here. This one is called the anterior horn. A small portion which protrudes behind, and that's called as the posterior horn. And there is a lateral part of the ventricle which protrudes below inside the temporal lobe, and this is called as the inferior horn of the lateral ventricle. Okay, so this is the central part of the body of the lateral ventricle, posterior and inferior horns. Now, the posterior horn, the body, and the inferior horn meet together in this place, and this is called as the trigone or the atrium of the lateral ventricle. Now let's see the relations of each one of these different parts of the lateral ventricle. The central ventricle, the central part or the body of the lateral ventricle is bounded on the roof. So this is the central part of the lateral ventricle. The roof is formed by the corpus callosum, and medially the structure which is present which separates the two lateral ventricles, so that's the septum pellucidum and the fornix. The floor of the lateral ventricle, it's formed mainly by the thalamus, the caudate nucleus, and two structures between them, which is the thalamus striate vein and the stria terminalis. Just above the floor, you can see the fold of ependyma and the choroid plexus, which is present in it, so the tela choroidea. So this choroid plexus helps in the formation of the cerebrospinal fluid. Now let's see the anterior horn of the lateral ventricle. The anterior horn of the lateral ventricle, so this is a coronal section showing the anterior horn. So it appears roughly like a triangular part. The roof is once again by the corpus callosum, and medially it is separated by the septum pellucidum, right? And there is also on the floor the caudate nucleus, the head of the caudate nucleus, and a small portion of the corpus callosum which is called as the rostrum of the corpus callosum. The anterior horn, there is no tela choroidea, so there is no choroid plexus which is present in the anterior horn. So these are the relations of the anterior horn of the lateral ventricle. The posterior horn of the lateral ventricle. The posterior horn of the lateral ventricle, so it is bounded by the posteriorly by the occipital lobe, and the roof, it's mainly formed by the structure, the white fibers which are called as tapetum, which forms a part of the corpus callosum, and medially it is formed by a bulb of the posterior horn. The bulb of the posterior horn, which is produced by the forceps major. These are the white fibers, the white fibers of the corpus callosum. So they produce an indentation. So that's the bulb of the posterior horn. And another part which is present in the medial is the calcareous. So the calcareous, it's the white fibers, the white matters, which is formed by the calcarine sulcus. So the calcarine sulcus is quite deep and it makes an indentation in the posterior horn, which is called as the calcareous. The inferior horn. The inferior horn of the lateral ventricle. So here the roof and the lateral ventricles, they are considered to be together. So here you can see this is the cavity of the inferior horn. The roof is formed by the tapetum and the tail of the caudate nucleus, stria terminalis. So this one, the caudate nucleus is, at the end of the tail of the caudate nucleus, there is amygdaloid complex as well. So that also forms a part of the roof of the inferior horn of the lateral ventricle. Now the floor of the inferior horn of the lateral ventricle, it's mainly formed by the hippocampus and the white fibers which cover them, which is called as the alveus. And there is a fimbriae, and there is an indentation which is produced by the collateral eminence, the collateral eminence, which is produced by the collateral sulcus. So these are the structures which are bounded on the inferior aspect of the inferior horn of lateral ventricle. Now let's see about the third ventricle. The ventricle which is present in the diencephalon, folds of the ependyma, and the tela choroidea. So here you can see the folds of the ependyma forming the tela choroidea, which forms the roof of the third ventricle. Excuse me. Let's move on to the fourth ventricle. The ventricle, it's located between the pons and medulla, which is located on the ventral aspect, and dorsally by the cerebellum. It has got a roof, floor, and lateral. So in this picture, here you can see the fourth ventricle. So this one is bounded anteriorly by the pons and the medulla, ventrally, because the brain stem is actually a little slightly tilted, and this one forms the roof. This is the floor of the fourth ventricle, and on either sides there will be lateral ventricle. Calamus scriptorius. Calamus scriptorius. So now we would check on the structures which we have seen. We have seen the rhomboid fossa, that is stria medullaris, median sulcus, sulcus limitans, the median eminence, facial colliculus, vestibular area, the hypoglossal triangle, vagal triangle, area postrema, calamus scriptorius, which is the lowermost part of the fourth ventricle, and the obex. Alright, so now there are three more structures which we yet to see: the locus ceruleus, superior and inferior fovea, area postrema. You can see through this portion they can take the CSF, so that's called papilledema. The papilledema is found in the retina. You know that the retina, the optic nerve, is lined by the arachnoid matter, and there is an extension of the cerebrospinal fluid which we can detect it by looking into the eyes through the ophthalmoscope. So usually there is optic disc which has got a well-defined margin, but here the margins are lost, the margins are blurred, and it's quite big. So this reflects that the pressure inside the cerebrospinal fluid is more, the pressure inside the ventricular system is more, okay, and this is called as papilledema. The next one is head injury. In any case of head injury, there could be leakage of blood into the ventricles. So in case if we do a lumbar puncture, we can find blood cells. If there is a blood, you need to make sure that there is no intracranial injury. But before doing a lumbar puncture, you need to make sure that there is no papilledema, because if papilledema is present, that's one of the contraindications for lumbar puncture, because already the pressure inside the CSF will be more, and in case if you do a lumbar puncture, there will be herniation of the brain, okay, and the person can immediately collapse. So always make sure that you check the eyes and rule out any papilledema before doing a lumbar puncture. And in case if there is a CSF, for example, the injury, you can also detect it after the head injury if the person is having any clear discharge through the nose. So that's also one of the points to indicate, to suspect if there is a head injury or a skull injury, okay, in which the cerebrospinal fluid is affected. Another most important sign is quick and state sign. So in this sign, what they do is they compress the internal jugular vein and monitor the lumbar. So through the lumbar puncture, they will be monitoring the CSF pressure. Usually when the internal jugular vein is compressed, so the venous pressure is increased, the superior sagittal sinus, which is present inside the brain, so the pressure is raised inside there, and the flow of CSF to the superior sagittal sinus is blocked. So as a result, the ventricular pressure increases, the pressure inside the CSF pressure increases, and this can be reflected through the lumbar puncture needle which we have inserted. So this indicates, the quick and stitch sign indicates that all the ventricular system is open and there is no block. Suppose if there is a block in the ventricular system, so if there is a block, if compress the internal jugular vein, the pressure will not be changed. So this is mainly to detect types of hydrocephalus, so which is called as communicating and non-communicating. The non-communicating, which means that there is an obstruction in the CSF within the ventricular system, that is either in the foramen of Monroe, aqueduct or sylvius, or in the outlet either due to an intracerebral trauma or due to a tumor, so which is an obstruction which is present inside the ventricles. So this is called as non-communicating, and communicating could be either because of increased production of cerebrospinal fluid like a choroid plexus papilloma, or due to an obstruction in the CSF absorption near the arachnoid granulations. Okay, so this can lead on to a non-communicating hydrocephalus, which is also called as a normal pressure hydrocephalus. The other one, if there is an obstruction in the CSF absorption, which is due to subarachnoid space, sometimes due to meningitis. So these are called as communicating hydrocephalus, and these ones are called as non-communicating hydrocephalus. Alright, so this we come to the end of the hydrocephalus of the ventricles of the brain and the cerebrospinal fluid. If you have any questions, you can email me or you can post it here in the YouTube channel. Thank you so much.